Okay, I think we'll start because I'm just aware we're 5 minutes over, so I think we'll just begin. So first of all, to say welcome everybody. It's been absolutely fabulous to see the interest in our Insight programme for South London. So I'd like to just begin by introducing myself and then my colleague Adele. So I am Professor Catherine Evans. I am a clinical academic in nursing. I'm a professor of palliative care and honorary nurse consultant, and also Deputy Director of the King's Clinical Academic Training Office. I co-lead this programme from King's College London with my colleague, Dr. Adele Stewart-Lord. So I'm just going to hand over to Adele to introduce herself.
Thank you, Catherine, and a welcome to everyone online this afternoon. We're really pleased that you can join us. I'm Adele Stewart-Lord. I am a diagnostic and therapeutic radiographer by background. Currently, I'm Associate Dean for Research and Enterprise in Allied and Community Health at London South Bank University, and pleased to be co-leading this scheme with all our clinical partners as well, which Catherine will be telling you more about later. So we're delighted to have you here this afternoon, and hopefully we'll be able to answer many of the questions you have. Thank you, Catherine.
Thank you, Adele. So what we're going to do in this hour is that we just want to focus on 4 main things, both to inspire you to be pursuing one of the scholarships that we're offering, to engage with us in our NIHR Insight programme, and really to be exciting you about why research is so important to be engaging with within your clinical careers. So we're going to begin with just by introducing the NIHR Insight programme, what that is, what the NIHR are funding very briefly, and specifically our programme in South London. We're then going to move into some of the detail around the scholarships that are available for this year, including the eligibility and the funding available. And then we're going to walk you through how to apply for a scholarship, including the process and the timeline, and then finally showcase the master's programmes available across our 4 university partners. So you'll see that we've disabled chat, but we do have the Q&A function available. So as you have questions as we move through, then please do post them in the Q&A function. Just click on that button on Teams and post your question. We'll either try and answer those during the webinar if we have time and we are able to, or if not, we will be using those questions to draft a frequently asked questions, so an FAQ that we'll then make available on our website. We'll also, as we move through, we have a generic email for our Insight programme. You'll also be able to contact us directly via that email address as well. Sorry about that. So just to begin with, so I just wanted to this is a new programme, the NI Insight programmes. So these are, the South London one is one of 12 regional programmes across the country. The NIHR, so the National Institute of Health and Care Research, has a national launch on the 13th of June. So after the 13th of June, we will then be able to, all of the different programmes will then be formally publicising what they're offering, who's leading them, and there will be more information. But we've been allowed to launch our scholarships earlier, really to give people a little bit more time to be understanding what's available and completing their application processes. So the Insight programmes, the strapline that you can see on this slide that the NIHR have was about inspiring students into research. And when they say students, that means undergraduate and postgraduates, as well as health and social care professionals. So that's their target audience. And the Insight programmes are part of the NIHR's 30 million investment in expanding portfolio of training and career development for health and social care professionals. So many of you might well have seen that announcement that happened last year in November. And the Insight programme is part of that investment in underrepresented professions. So that's very much who the Insight programme is targeted at, underrepresented professions. And the reason they're doing that is to increase the diversity of people entering and pursuing rewarding research careers. And what the NIHR mean by underrepresented professions is very much about attracting nurses, midwives, allied health professionals and other registered health professionals, public health and social care practitioner academics into research. And what they're wanting them to do is to pursue, engage and pursue research much earlier in their research careers. And the quote on the slide from the Dean of the NIHR Academy very much sums up that ambition of the Academy of increased effort to attract and support underrepresented groups into a research career, including from people when they first consider a career in research, so as early registrants, as well as students. So this funding is very much part of that ambition. So just thinking then about the NIHR Insight programme for South London. So as I said, this is one of the 12 regional programmes that the NIHR have funded. As Adele and I said at the beginning, we co-lead the Insight programme. So this is a joint programme for South London between King's College London and London South Bank University. You'll see on the slide that I've also put the logo of our King's Clinical Academic Training Office. So for us at King's, we're very much leading this through our Clinical Academic Training Office in very much building and capitalising on our existing infrastructure for supporting health professionals and those in social care to pursue research careers. And then what you can see on this slide is our many partners in South London that we have brought together really to increase the breadth of offer that we can provide for people to engage with research and to maximise our reach to colleagues across South London. So you can see on the left-hand side our university partners, so our higher education institutes. So that's King's College London, London South Bank University, Kingston University and St George's University of London. And then what you can also see, I've given the detail around the various faculties and schools that we've also brought together across those different institutions. And that again was very strategic to enable us to maximise the breadth of our offer across disciplines and across care settings. And what you can see on the right-hand side are our NHS partner trusts. And again, you can see there's 7 NHS partner trusts, and you can see a diversity of both acute hospitals, of community trusts and specialist hospitals with the Royal Marsden Oncology and the Royal National Orthopaedics, obviously focusing on orthopaedics. So again, very much that messaging about maximising the diversity and the inclusivity of the programme that we have constructed. So in this infographic, I just wanted to give you a little bit more of a flavour of, well, what exactly is our Insight programme for South London? What is it that we're actually trying to do? So the programme began on the 1st of April. We only received our official award letter just a few weeks ago. So I have to say, it has been a lot of work for us to pull all of this together within the short time frame. And we ask you just to be supportive of us in that we're having to work at pace to be able to set these scholarships up so that they will be available for this academic year for people to start in September, October of this year. So, and the programme is funded for 3 years. So the scholarships that we're offering this year, we're offering 30 and we will offer a further 30 next year and the year after. So our ambition of our South London programme, as you can see at the top, is to inspire students and early career health and social care registrants to engage in research from the start, to pursue research careers early in their training. And the way that we aim to achieve that is by delivering 2 main things. One is an innovative and inclusive programme of research engagement activities. And the second is our Research Masters scholarships. So today we're focusing specifically on the Research Masters scholarships. The research engagements activities, we will now plan those with some offers over the summer, but really beginning in the autumn of this year. And then what you can see in the middle boxes is what we want to achieve. So across those 4 university partners gives us reach to over 10,000 undergraduate students, which is phenomenal reach. The way we've designed the programme is that we are able to have offer to diverse professions across the community, mental health, acute and social care. Our intention is that we will have a virtual online research hub so that people can access our resources anywhere. That at the moment is in setup. And then finally, our overarching aim is to debunk the mystic around research. So for people to feel inspired to engage in research and feeling that it's something that it's accessible and important for them. And down at the bottom just details the Research Master's Scholarship. So I said in total we have 90, offering 30 each year for the 3 years of the programme. And we're offering over 20 courses across our 4 universities with the intention that the courses can support a breadth of research careers. So we're very mindful that there are many different research careers that are open. So for example, that's in advanced clinical practice, where research is very much one of the key pillars of the advanced practice framework, pursuing a career as a clinical academic, pursuing a career in research delivery, and also within education. So the programs that we're offering intend really to enable people to pursue those different career options that are open to them. And then over on the far right-hand side, as I've said, is our partners. So our world-leading universities, the diversity of our NHS trusts, and also the other NIHR organisations in South London who work alongside us to support and ensure the success of this programme. So what I'd like to do now is just move on to the scholarships for Research Masters. So the first thing to say that colleagues have been working at pace to be able to get our website up ready for today. So I'm really pleased that we're able to share the QR code and the web address for that website. So the website details exactly what the programme is, all about our partners. Everything that Adele and I are going to share with you now is on that website. So the eligibility, the process to apply, how to access the electronic application form, and the various steps that you will need to follow to apply for a scholarship. So I hope I've given you all enough time just to scan that QR code. Also, if you Google, it will probably come up as well. So first of all, in talking through the scholarship eligibility. So as I said right at the beginning, the Insight programme is funded by the NIHR. So the eligibility criteria very much follows the criteria that they have detailed on their Insight website. So eligibility requires a person to be either a student or a professional from a registered healthcare, social work or public health disciplines. And the NIHR target group is individuals at an early stage in their career. So I'm just going to unpack that a little bit. So when we say students, that might be individuals who are undergraduate or postgraduate, and they're working towards a registration in one of the regulatory bodies that this scholarship is supporting. So when the NIHR talk about an early career stage, the groups that they are targeting is people within the last 3 years of their registration, and obviously excluding career breaks. So you'll see when you look on our application form for the scholarship, we've asked you to tell us the date of your registration. And we've also asked you to detail any career breaks, for example, for maternity leave, paternity leave, or for a period of extended. In our programme, though, we have put that as a desirable criteria. So it's not an essential criteria that you have to be within 3 years of registration, but it's something that we have to be mindful of, that the NIHR are targeting this funding at that group. And the reason we've done that is to be really inclusive in the way that we are offering these scholarships. We're very mindful that people's careers after registration can be highly variable, and often people have not had opportunity to be able to study at master's level. So we've included a degree of flexibility in the early career stage interpretation in our scholarship offer. So this programme is in South London. As I've said, there are a further 11 regional programmes, so there's also a regional programme in North London. So to be eligible for the South London scholarships means that you need to be either employed or studying within South London, or you are employed by one of our partner organisations who are located in North London. So that includes the Royal National Orthopaedic Hospital and also Central London Community NHS Trust, that obviously their services extend across London into North London. So in terms of the eligible professions, the NIHR have detailed that individuals need to be training towards or registered with one of the following regulatory bodies. So that is really what determines your eligibility. So you will see it has the General Medical Council and the General Dental Council listed here. But this programme is open to professions outside of medicine and outside of dentistry. So it might well be that an individual might be a dental hygienist and they are registered with the General Dental Council. So just to be clear that the eligibility excludes individuals who are medical doctors or dentists. So just in moving through, the next most important and big question is, what exactly does the scholarship fund? And in summary, it funds two main things. So first of all is to cover the tuition fees for the master's programme. And we do appreciate that the programmes vary in terms of their fees. We accommodated that within the budget that we have secured from the NIHR. So all of the courses that we offer, we are able to cover the respective fees for them. The second part of the scholarship is the stipend. So the stipend is just over £20,000. This includes London allowance. So we requested funding for a slightly higher stipend for us in South London to be able to include the London allowance. That stipend is per annum or pro rata, depending if you are studying full or part-time. So if it was part-time over 2 years, that 20,000 is then split across the 2 years. So a stipend is most typically provided to students for their living expenses. But we're very mindful that many people who will be applying for the scholarships might well already be in full-time or part-time employment. So our intention also is that the stipend can then be used as a contribution to salary costs for clinical release. So at the moment, we have been working within the respective universities and with our respective NHS trusts to be able to set up a recharge scheme. And that is something that we're working on at the moment, because it's something that we've not been required to do before. So it's something that's less familiar to us. So we are just setting up those processes to achieve that. But that's very much the intention, that if you are fully employed, or even if you're part-time and you're intending to study in your clinical hours, that funding is a contribution to your employer to release you from your clinical duties. So the employer might be an NHS trust. It might also be that you are, for example, a nurse within a care home and your employer is your care home provider. Okay, so I'm sure there'll be lots of questions about this, so please do pop them in our Q&A so that we can pick them up either in the webinar or outside of the webinar. So now I'm going to hand over to Adele just to introduce the courses that we are offering.
Thank you, Catherine. Yes, just as a reminder, everyone, we're not taking any questions, but we do hope to be able to answer your questions. I've noticed quite a few in the chat already. And as Catherine mentioned, this is new to us, so we are learning as we are going along how to deliver this programme successfully as well. I'm starting off with the courses being offered at King's College London. I'm not going to read each one of these on the list, but please have a look at them and you can identify if any of these courses might be of interest to you. As shown previously in the QR link and the website, these courses are outlined on our website as well, with links to the respective application portals as well. Next slide, please. Checking where Catherine went. Wonder if, thank you. It might just be a delay in our response. So the courses offered at London South Bank University, again, you can see are slightly different from the courses offered at King's, and that's in showing our breadth of offering across the different universities, having some allied health professions courses in here as well. And very importantly, at the bottom, please note that we do actually fund some top-up courses as well, but you will be required to do a research project as part of your dissertation for the top-up 60-degree credits as well. So that's a unique offering under that as well. Next slide, please. At St George's, University of London, we have a number of courses available there as well, and you can see different pathways again for different professional groups. The last course on there is just awaiting NIHR approval, but it's currently listed on our website as well. But once final approval will be approved, that will be available as well. Moving on to our next slide, please. And then last but not least is Kingston University, and very pleased to see that we have a public health offer as well for our applicants in public health, which is starting for the first time 25-26. So really nice. I hope that you can see across the universities the breadth of offering in the different courses that we have. I'm now going to move on, thank you, Catherine, to the next slide in talking you through the application process. Very important to note that it's a two-part application process. I will repeat that a few times just to make sure everyone's really clear. Firstly, you do need to apply for the scholarship. The scholarship funds, as we said, your course fees as well as the stipend. This application for scholarships is also available through our website. There's a link specifically on the website that you can follow. And in bold, we've put there the deadline is 5 p.m. on the 1st of July. So we recognise it's quite a short turnaround. You basically have just a bit longer than a month to really get your application in. But the details of the respective programs is on the site, the website, which we've shared with you earlier. And then at the same time as filling in the application, you will also be required to submit a letter of support for your employer. Now, we recognise that applications take a long while, so we are recommending that you actually use the template available on the website to prepare your application offline. And then when you go online, you can literally copy and paste from your Word document into the Qualtrics website, which allows you to make the process more speedily and efficiently when applying. It will save your application if you go in through that, but it's always better to first prepare it in advance and use the template for that. Then you are prepared for all the questions that might be asked within the application. So it's useful for you to go and look at what you are required to do in advance. There's an element in there that's asking you about your profession, your registration, employment details, some demographic data. And there's a section asking you about your interest in the program and what you intend to study. All of these elements take some time to prepare. So we ask that you take your time in advance to really write out these statements prior to going online. I would like to emphasize at the bottom of the last bullet points, the employment letter of support. Now, within our partner trust, this might slightly different who signs off on your actual application. Many of our senior trusts actually require the lead education department to sign off, or the lead nurse in the trust. So please ensure that you actually discuss your application not only with your line manager, but with the education lead in the trust, as there are financial implications in terms, as we mentioned, the scholarship and the sponsorship for that, and the sign-off for you to be released from the trust to actually engage in full-time or part-time education. Therefore, I would recommend that you start these discussions really early with both your line manager and the senior education lead in the trust to determine who's allowed to sign off your actual application. That letter of support can be attached with the application. Please again use the template provided on our website for that. So to confirm, this is the third stage of the application process. This stage is to ensure that you get shortlisted for funding and for a scholarship. At the same time, and now I'm going to move to the second part of the application process. Thank you, Catherine. You need to apply for the respective master's course that you are interested in. The links to the respective master courses are both on our website, but you can also seek them from the university directly. This is a completely separate application process, and this ensures that you meet the university requirements for the actual course, meeting the course criteria for entry and admission to enable you to enroll onto the course. You will only be able to progress if you have both applications in process. So any type of offer we make in terms of scholarship would be subject to you being accepted onto the university course. So each university has their own admissions requirements. Please read these carefully when applying for each course. So ensure that your scholarship application is completed and submitted by the deadline. The course applications all have different deadlines, but we do expect that you will be applying for both at the same time. So it is in tandem, apply directly to the respective university for the course that you wish to undertake. There's a requirement for a personal statement in most of your course applications. Make sure that you outline in your course application that you have also applied for the NIHR Inside South London Research Master Studentship. Use this wording because it highlights to the program admissions department or the admissions tutor that you have applied for funding for this course as well. So it links the organization, the respective higher education organization with us in terms of the sponsorship as well. So make sure that you apply for the master's course process through the respective university. As I've mentioned earlier, our website, the NIHR South London website, details all the application processes, and there are respective links for you to follow as well. Thank you, Catherine.
Thank you. So I can see that colleagues have been joining us as we've been moving through this presentation. So the first thing to say that everything that we've given on this presentation is available on our website, and that again is the link to the website. Yes, we will be sharing the slides. Either we will email those to individuals who registered on Eventbrite, so we can share those with you quite quickly so that you've got them. What's important is that you are able to connect with us. So also on this slide, you can see our generic email for the Insight programme. So the questions that are popping up in the chat, we will, as we said, we'll put together a frequently asked questions responding to everything that has been posted. Some of those we might quickly be able to respond to in a minute. We've got time to do that. The other thing that's important is that, as Adele mentioned, the application for the scholarship is an electronic application, which is through Qualtrics. That is the web address for the Qualtrics application. It will be easier for you to access it if you go to our website first. And just as Adele said, is on that website is the Qualtrics application. the Word document template for you to draft your application. But please remember, you need to submit your application on Qualtrics. So if you write it in Word, then you need to copy and paste it into the Qualtrics and then submit it through the Qualtrics. The Qualtrics, once you've submitted it, you can't make any amendments to it. So if it's submitted, you've submitted your application. While you're writing it, if you don't close your browser, it will remain, your form with your contents on it will remain there, but it's probably much safer to write it in the Word document first and then copy and paste it into the Qualtrics. And we very importantly put the close of 5 o'clock on the 1st of July, and we put it as 5 o'clock so that if people have any technical difficulties, you're able to contact us during the day on the 1st, but I would urge all of you not to leave it until the very last moment to submit your application. And then in terms of timelines and shortlisting, for us on the Insight programme, we have a shortlisting panel. I think we meet on something like the 9th of July. That's when we will be reviewing all of the applications received. Our intention is to tell you the outcome of the awardees for this year, certainly by middle of July, no later than the end of July. And the reason we've done that is to, obviously you are applying in tandem for your master's course, and you need to know if you've got a scholarship and if you've also been accepted on the master's programme that you are seeking to pursue, so that you can obviously inform your line manager and your research and development leads that you have been successful. I've also put on this form the link to our clinical academic training office at King's. That also has lots of resources to support you in pursuing research within your clinical career. So just to flag that as well. So I think we can probably very quickly, Adele, go through. There's any questions that we can answer quite quickly. I think we could just do that now. So a lot of the questions are around the stipend. So if I just begin, and Adele, and then I'll come to you if there's other things that you think I can quickly answer that. So
yeah, there's one that I think we can just start with, Catherine, if that's all right.
Go ahead.
And it's in relation to eligibility. Unfortunately, we are only able to offer these to home students, so they are not open to international applicants. I think there was a few in the box around that. So that's just the first one, I think, which is important around eligibility. Thank you, Catherine.
Thank you. But having said that, individuals who are, for example, international registered nurses, as an example, or other international colleagues who are employed by the NHS on skilled worker visas, my understanding is that you would be able to be eligible for home fees on the Insight programme. So that is something that we have been looking at within the university, but that is my current understanding, that if you are on a skilled worker visa and you're employed, for example, by the NHS or by a care home on one of those skilled worker visas, you would then be eligible for home fees. So very much around wanting support capacity building for example, international nurses who are working, for example, within the NHS. But if you are an international registrant and you're not on a skilled work visa, and then no, we are not able to pay international fees. So just to clarify that. Is there any other ones quickly, Adele, that you could see?
I think there was just around the full-time and part-time employment within the trust in terms of their scholarships being allowed to be used towards clinical, and not if they were part-time and doing the course in their own time, could they retain their own scholarship? So that was something that came up as well around the full-time and part-time scholarships.
So I think, Adele, as you said, this is very much going to be about people negotiating with their employer about what's possible. So if you are in full-time employment, that will require negotiation with your employer about being released from your clinical practice to be able to study for the master's programme. So we are offering the programs part-time and full-time. So that's what you would need to negotiate with your employer to study part-time, for example. And then the way the different programs are offered, you can see, for example, the MSc in palliative care at King's of study. So each term there would be a 2-week block. Some of the other courses, it might be a day release for the academic term. So that's the other thing, that when you are looking at the courses that are available to you, is to see, well, how are they being provided? And some of them are entirely online. For example, the MSc in Research Delivery is entirely online. That then gives a little bit more flexibility in terms of when you are studying. So the first thing is to say, yes, if you're employed full time, but you need to negotiate your release with your employer.
There was one other question around the part-time scholarship. If you awarded it for this year and your course continues over 2 years, then yes, as Catherine mentions, your stipend will then be part-time, but you will be receiving the fees for the next year as well. So if it's a 2-year course, you will be awarded fees for the 2 years to complete. The stipend will then just not reduce, but it will be split over the 2 years to support you as a part-time student, yes.
Thank you. And then I can see there were some colleagues who joined us from the West Country, I think it was from Devon. Just to say, if you are located outside of South London, the NIHR Insight programs, there is one per region. So there will also be an equivalent program being offered in the Southwest. So please do also be looking out for those, because all of the different regional programs will be announcing and promoting the scholarships that are available. And as I said, the NIHR will formally announce on the 13th of June the 12 regional programs that they have funded with the respective leads, so that you will then be able to connect with the program in your respective region.
And there was a question from someone around if they part of South London, but not one of the partner NHS trusts. Yes, you can apply. You don't have to be one of the partner NHS trust employees, but you have to be based in South London, as Catherine has just mentioned. So hopefully that addresses that question.
Yes. So our NHS partners, and remember, it's NHS, it's also care homes, individuals working, for example, in social care, or for a home care provider who have either have a registered qualification or working towards a registered qualification with one of the regulatory bodies that have been indicated by the NIHR. And our NHS partners on the Insight programme is very much in working with them for us to maximise our reach to our clinical colleagues, as well as the second important part of the programme, which is around the research engagement activities. So that's very much what we will be working with our partners on. But just to reiterate, the scholarships are available to everybody employed within South London who meets the eligibility or is studying. So just to clarify, in terms of the student, so if you are an undergraduate student and you are in your final year and due to graduate this year, and you'll be attaining one of the registrations that are eligible, you could then be applying now for one of the scholarships to commence a master's programme in the autumn of this year. And similarly, if you are studying at postgraduate level for a registration, for example, as a physiotherapist, you would also be entitled to apply for a scholarship to do a research master's, like an MRes, for example, to be developing and enhancing further your research skills alongside your clinical training. Okay, any other questions, Adele, that you think?
Yes, there was one interesting one around how does the NIHR Insight programme aim to impact healthcare research initiatives in South London? So just to remind our audience that today's webinar was just about the master's programmes and the scholarships we have as part of the South London programme. We are developing a programme of activities to enhance research, to get people into research careers, to raise research skills, awareness and training. And that will be following shortly over the summer to be launched effectively in the autumn, as Catherine said. So we apologise. We are doing this part first to allow people enough time to apply for the respective courses, which are hoping to start in September and October. But more information about the rest of our programme will follow over the next few months.
Thank you. And then I can see there's a question, if I've been working in the research department within my career, will that make me ineligible? No, not at all. It's and as I said right at the beginning, the intention is to support a diversity of research careers. So if, for example, you have been pursuing your career within research delivery, hence why you might be working within a research department, the programme is also about supporting that career pathway for individuals working in research delivery. So particularly one of the master's programmes that we offer is the MSc in Health Service Research Delivery, which is the one that is entirely online. So please, we're looking to support a diversity of careers and a diversity of career pathways that people have pursued so far. What's key is that you are a registered health or social care professional and that you are registered with one of the regulatory bodies that the NIHR has indicated is eligible.
Catherine, I'm just going to go back to the point we made earlier in terms of the 3-year post-registration, which NIHR recommend as a criteria. Like we said, we're not going to be too strict on that criteria in our consideration for applications. But obviously, if someone's been within the employment for a number of years, say 10 years, and has not actively pursued any career pathway in research, it's unlikely that that applicant will be considered a strong applicant compared to someone else who's maybe shown an earlier interest in a research career. So we don't want to exclude anyone, and that's why we said we will look at the criteria or every application individually. I would recommend people apply and in your actual motivation or your rationale for application, please make it clear what your rationale is for applying for a research career, or demonstrate what you have done up to date to enhance or develop your own research career. As we've recognised, there might be people that have been funded for master's modules but haven't completed their dissertation yet because they haven't had funding. So there's lots of reasons why you might be in that position. So please feel free to apply. Do not be put off by that, but do recognise, of course, that we do have to work within the criteria offered as well.
Okay, thank you, Adele. And I can see the questions are getting harder. So there's one again, people asking about eligibility. As a psychology practitioner and previously in AHE, but no longer registered. I think with things like that, it's really helpful for us if you can put them in the Q&A, because these are things that we then need to take back to the NIHR to say these are individuals who are looking to apply for this Insight programme, but at the moment they're not meeting the eligibility in terms of the regulatory body that they're registered with. So please do pop that in the chat, because those are things that we need to be taking back to the NIHR, because as we saw right at the beginning, their intention is to be diversifying the workforce within health and social care. And it's important that they have a full understanding of the diversity of professions within health and social care, that it would be important to be supporting to realise their ambition of diversity and inclusivity in the way that they're working. And then another question around the credits. So Adele, maybe you can pick that up, because you mentioned about if people have already got some credits, that we have funding for
Yeah.
top up.
Yeah, so just to make it very aware that every university is different in terms of their APEL and pre-accreditation process. So please make sure if you are considering a course that might consider previous credits, is that you need to discuss that with the respective university, because they are all different in how they apply that. Some have criteria in terms of time, so they do not consider credit that's more than 5 years old, or in terms of eligibility for top-up degrees and that. So please make sure that you do address those questions to the admissions tutors for the respective courses before you actually apply, because you need to have answers for that from the university. That is not a decision that we involved in terms of that. It's the eligibility of the course. So like I said, any sponsorship or scholarship will be subject to you meeting the criteria or the entry criteria of the course of the respective university. So I would advise anyone that's in that type of position to speak to the admissions tutor directly as well.
Thank you, Adele. And then I can just see a query about the within 3 years of registration. So absolutely, that this is something that we've put as desirable, is not an essential criteria for us in the South London programme. But to be mindful that for the NIHR, their target group and their intention is to enable people to engage in research earlier in their professional careers. So what would be important is that if you have been registered for a lot longer, is to make sure that in your application, we ask you about, why you're applying for your scholarship, to be detailed, making a case to say, this is why I want to do this. Also in the box where we ask you, have you had any career breaks, is to make sure that you don't need to tell us lots of information, but we do need to know if you've had a period of maternity leave, or you've had a period of extended sickness, for example, or you might have been working abroad for 2 or 3 years. So you need to just tell us that information, because that will then really help us in our shortlisting and the awarding of these scholarships. And the other thing just to be mindful of is that we are offering 30 scholarships each year for the next 3 years. So if you are unsuccessful this year, please do look to apply again the following year. And our priority really is to make sure that we do award the 30 scholarships this year that we have funding for. And that's very much what we want to be doing, to realise our ambition to be building research capacity across the diversity of professions that are supported by this programme.
Catherine, I see one question there, which I think might be a very nice concluding question to answer with, and then the rest we will deal with in our frequently asked questions. But this question is, what is the NIHR expectations in terms of students post-qualifying or during training of the course? So with any type of funding, there's an agreement that you actually participate in the requirements of the course. That's really important as well, that you participate in the scheme and then you meet the requirements of the scheme. So there's the engagement activity, is that you inform people if you're not no longer able to continue. Of course, at that point, funding will be withdrawn as well if you are not able to continue for whatever reason. And then it's just post-qualifying or post-finishing your master's course, there is a question in the actual application form that asks you to identify or use an email address and saying that you are available for us to contact you post-qualifying to follow up on your career pathway, so that you will receive communications from us post completing the course or being sponsored through this course. So we can definitely look at more information and guidance regarding what is the requirements during the course or during your engagement with us, but it is like any funded scholarship with NIHR. So just making sure that you can look at their website as well, but we will also provide some further details on that, I think. Thanks, Catherine.
Okay, thank you, Adele. That was a nice one to end on, and to say thank you for all the questions. We will be responding to all of them. Some of them are quite tricky around visa requirements, and those are things that we need to talk through with our own respective visa compliance office so that we are giving out the correct information. So all of the questions that you have put in today, we will be reviewing all of them. And as I said, we will be responding to them and putting them in a frequently asked questions. And we will then be emailing that to everybody who registered on the Eventbrite. So I would like to say thank you very much for joining us today. It is absolutely fabulous to see the enthusiasm and energy for people interested in engaging research. That's very much what we wanted to do. So it's been a fabulous start for us on this programme to have our first launch webinar, to have such a lot of interest and engagement. And we're very excited to be working with our partners, working with people who've joined today, so that more and more individuals can engage in research and have opportunity to pursue that within their respective careers. So I'd just like to say thank you very much for joining us. We look forward to receiving your applications. Please do use our email if you have any queries around that. We're very much here to support you in that application process. And I'll just hand to Adele for any final.
Thank you, Catherine. I think you've said it absolutely all. Like we've mentioned earlier, just to remind you, we are new to this program as well. This is a brand new designed scheme within NIHR. So please bear with us as we deal with questions. Things are new, and with new things, there's always a learning process. And as we go along, we will learn from these processes. So we highly recommend you ask us the questions, and we will try and deal with them as soon as possible. But we are delighted to be with you today and look forward to receiving many applications shortly. Thank you, Catherine. Have a good day, everyone.